Good morning. This is John Fallett. It is March 18th, 2020, and we are all stuck at home trying to figure out how to continue to write business on the Medicare side of this industry. Today, we're going to be discussing telephonic basics, and obviously, we're discussing this once again primarily due to the coronavirus. We know that many events, your Oak Street House are being closed down for the agent of the day. Your Salvation Armies are being closed down. We had an event this week at the one of the community centers here locally in Michigan that is no longer offering their event. So we understand that the time in which it is in today's society is very difficult to get into a consumer's home. It's very difficult to get face to face with that consumer. So this morning, I want to spend a few minutes with you to go through telephonic basics. Obviously, I want most of your knowledge and information coming from the carrier sites. If you need carrier links or videos or anything specifically from the carrier, we would certainly be able to help you through that or provide it to you. But once again, I really want to go through telephonic basics with you. As an agent, I have not seen a consumer outside of the office or someone walking in 8 years' time. And I write a lot of business and I write business compliantly and I have very few complaints. That's not tooting my own horn. That's just making sure that you understand the process of how to conduct business compliantly over the phone, the systems and tools that you should be using, as well as the FCC requirements and CMS requirements to compliantly conduct that business. So let's begin. I won't keep you very long. Once again, this is a high level overview as we don't have a whole lot of time as I want to get you back on track, hopefully get you back on the phones and once again, get you offering coverage to these consumers who direly need it during this OEP time period where obviously they're wanting to switch plans. They're just not necessarily wanting to visit with you. So how do you not get left out in the cold when there are call centers out there, when there are agents out there that are writing business over the phone and just simply stating to Joyce that it's not a big deal. I don't necessarily need to visit with you. I know what I'm doing and can simply close you and write this business over the phone. So let's begin. CMS, carrier compliance. Obviously, we're going to review some consumer links, lien apps, connectors, DRX, as well as what CMS and the carriers require as a compliance standpoint. Stay tuned. There are new emails coming out daily from carriers as well as CMS, loosening some of the CMS requirements that are currently set forth. So understand where we're at in regards to this coronavirus. This may be a complete change in our industry, and obviously those that can adapt survive. It's not the strongest that survive, it's those that can adapt. So this is the time to adapt. You do not have to visit consumers to compliantly offer insurance. It was part of the AHIP exam several years ago where it asked you, can an agent force a consumer to sit down with them? True or false? And obviously, you cannot force anyone to sit down with you. So understand that you do not have to see any consumer at any time as long as you take the necessary steps. So first and foremost, are you able to prove that the sale was not engaged from an outbound solicitation call? You cannot pick up the phone book. You cannot start dialing addresses or reverse white page people. You cannot stalk people in that fashion. However, if you did a mail drop and that consumer is requesting information, you have every right to phone that consumer and assist them. Your due diligence, cover your hiney, ensuring you are protected. You have to make sure that you are doing the appropriate steps. So if you do ever have a complaint, you have the right signatures, the right paperwork, your calls perhaps are either recorded or stored somewhere, that you're keeping records of your inbound calls if you're using a cell phone, downloading that on a monthly basis if needed from your cell phone provider. You have some kind of CRM program set up through a number of different CRM companies that will record your calls for you to assist with your compliance. Have you reviewed your carrier changes and updates? Once again, there are new emails coming out every day, new updates coming out at this point in time, and making sure that you are on top of this to understand what the compliance of the carriers are requiring as this does change. Lastly, You are more than welcome to go into the CMS Medicare plans managed care marketing website, right? It's the CMS portal for Part C marketing guidelines. If you need the link sent, we'll send it once again in an email, as we had some technical difficulties this morning with sound. However, very important that you understand your CMS marketing guidelines. To help you through those CMS marketing guidelines, we have put together a PDF for you that looks like this, and I want to review it with you briefly. What are Medicare's rules for how and when Medicare Advantage and Part D plan representatives can call beneficiaries? Well, you as an agent or a broker can call current plan enrollees, call beneficiaries who submit enrollment applications to provide guidance, call former enrollees to discuss why they disenrolled, call individuals who have given permission for a plan agent or broker to contact them. That's the key. It's your marketing. It's getting out into the consumer's mailbox or into their email compliantly, into their social media compliantly, and making sure that they're contacting you or that you have proof that they attempted to reach you, either a voicemail, a call log, a recording, or a business reply card from a postcard. Return phone calls and messages from individuals or plan enrollees. Obviously, as I mentioned, you cannot make unsolicited calls. You can't call based on referrals. You can't call to market a plan or a product to an enrollee who is in the process of disenrolling. You can't call an individual to ask if they received mailed information. So understand and review the Medicare marketing guidelines. It is very, very important that you remain compliant through this time period and through this process. Two ways to complete applications. First and foremost, I'm either going to close you right over the phone, or I'm going to provide you a compliant presentation. I'm going to mail required documents. I'm going to provide a postage paid envelope to you, and I'll go through all that here further in a moment. With a telephonic, obviously, I have you on the phone. You have an email address 99% of the time because most consumers have a smartphone. I complete the enrollment process. I'll go through the carriers and their specifics with you in a moment. And then at that point in time, the consumer's off and running with new coverage. So let's go through this specifically. Most consumers, as I mentioned, are on a smartphone or on an iPad. There are conferencing tools that you should download, know, and utilize. Join.me is the first one. With Join.me, it's a super easy free app to download on your phone or on your iPad. The consumer then gains access to my computer to where they don't have any capability, obviously, of touching anything. They're just screen sharing with me, and I be able to walk them through a presentation compliantly. Team Viewer is slightly different, where that allows me access into the consumer's computer. So I complete an application on my end through whatever carrier, we'll get there in a second, but Joyce can't find the email from the carrier. Joyce can't complete that application because her typing skills are awful or she's partly blind due to glaucoma, etc. I will assist Joyce, obviously, in getting that application completed from her IP address from her computer. Go to meeting, Zoom, get response. There's a slew of conferencing tools out there. When I'm on the phone with the consumer, Joyce, let me bring you into Medicare in my world for a moment. Come join me in my seat, viewing what I see and helping you. Then that sales process goes seamlessly, smoothly. Make sure application is complete, set, and consumer expectations. If we are sending out paper applications, I'm explaining in detail how this process is going to work. There's an envelope I'm sending you. I'm going to stamp or write my name on the back of it and highlight it and let the consumer know that you have an envelope coming from Senior Enrollment Solutions. On the back, I wrote from John, so you know exactly who it's coming from. At that point in time, I'm also going to let them know the expectation of how this is all going to transpire. Today is Wednesday. It's not going to go out until tomorrow's mail, which is Thursday. You're in Flint. You're roughly 2-3 days away. So let's say by Monday, you should have this envelope. Joyce, I'll follow back up with you on Monday afternoon to make sure that you've received it. At that point in time, if you've received it beforehand, call me. Otherwise, I'll go through exactly what I sent you and I'll make sure that you understand specifically what we're discussing. In the envelope, I have a cover letter that is in color, business cards so Joyce can reach out to me, have my fax number, my email address, etc. Obviously, a postage paid returned envelope specifically for the DSNP and the MAPD consumer. So if I'm sending out an application to a DSNP consumer, it has to have that postage paid envelope. Oftentimes, they don't want to pay for the postage to send it back to me. Sign here stickers. Realistically, I only need 2 signatures from you, correct? The rest of it I can gather over the phone. So, Joyce, I only need 2 signatures from you. I need you to put it back in this postage paid envelope, send it back to me. I'll gather all of your specifics, your private information over the phone securely, so that way it's not going through the mail, no one's touching it. Once I get the application back at that point in time, I'll phone you to confirm I've received it. I'll gather your personal information. I'll get it securely submitted to the carrier. So that timeline, those expectations are crucial, and your follow through is even more important. You need to know which applications are being mailed out, how many you have en route, how many are back, how many are pending. You need to make sure that you're organized, especially when mailing out applications, so that way your rate of return is as high as it can be. Barcodes. Aetna, Humana have specific applications, right? There's a number or barcode on the bottom of them. Scan the applications, the entire application, save it under Joyce.318.2020 or whatever you need to save it as, to make sure that if Joyce only sends you just those 2 signature pages back, one for the application, one for the scope of appointment if not already completed, that you're not running into a pickle that you can't submit the application because you don't have the rest of the pages. So every application that has a barcode or a number on the bottom of it, scan into your computer, save it, send the app out, because I assure you most of the time it's not going to come back as a full application. Or you can always take the chance and staple all the pages together, detach them out of the application book, right? You never know if Joyce has crippling or disabling arthritis, etc. So remove those pages, staple them together. Obviously, mailing wise, they're going to come back all folded up in a smaller envelope, which isn't necessarily what you're looking for either. And the scanning of that makes it more difficult as well. So I always just scan them. I send them out in a large envelope. I am very, very specific on how this is all going to unfold for the consumer. So there's never a question or a concern. The consumer has, once again, my email, my fax, my phone number, and they also have instructions not to open it until we talk again or they phone me, and then we can go through it together. Carrier requirements. Let's begin with Aetna. Aetna uses many different options for you as an agent. First, you can use their rate to enroll your clients right over the phone. That rate tool is amazing. You can also send quotes, specific quotes of that one plan, so there's no confusion over to the consumer. You can also use a send. They offer a scope of appointment hotline, which is just a pre-recorded voicemail, if you will. If you need instructions, let us know or go onto the Aetna.com website. Then obviously you also have Connecture and DRX. So with Aetna, they offer multiple ways of being able to compliantly make that sale over the phone. And they also provide you the ability to record and store that information for you so you don't necessarily have to. Next carrier I want to discuss is HAP. We are skipping over Blue Cross Blue Shield. Blue Cross Blue Shield offers paper applications. You can download the PDF. That is a paper application unless you're belly to belly with the consumer. And Bright Health for those agents in the Toledo market in Northern Ohio. Bright Health is currently working on an online application process, but currently they are paper. So moving down to HAP. HAP has several different options for you. One is a consumer link. So I talked to Joyce over the phone. We'll just keep it the same name. I talked to Joyce over the phone and I say, hey, Joyce, it appears as though after running your medications, et cetera, giving you a compliant presentation, that HAP is the right plan for you. HAP has a consumer link. You would obtain that through the Ascend application. I would email that link right to Joyce. And as you can see, the site was accessed using a personalized URL. All applications entered will be credited to John Fallett. So I am the agent of record by just sending you out the consumer link. At that time, Joyce would go through the entire application on her own, or once again, you can use Ascend and you can send over the rates, send over quotes, etc., to the consumer. Next, Humana. Humana offers an online application through their Fast app. I would complete all of the information. Joyce, I need your address, date of birth, Medicare claim number, etc. I would complete all the fields. It would email over to Joyce. Joyce would then open an email from do not reply at humana.com. She's going to need to dig into her bulk, into her spam. Once again, that's where TeamViewer or other conferencing tools work very, very well. Or you also have the option to go right into Connecture or DRX. You can send a quote, and then the consumer completes the application seamlessly through that platform as well. Once again, side note, Humana has barcodes. Keep that in mind if you're sending out applications via paper. Molina. Molina offers an online application through their portal through the Connecture DRX platform. So super easy in regards to Molina. Obviously, that is primarily a DSNP carrier. Most of the time, we are sending out paper applications, doing good follow-up and follow through. The paper applications come back, and we then just submit it to the carrier. United Health. United Health offers their Lean app now. Through their Lean application, you can simply enroll right through the jarvis.unitedhealthproducers.com, something of that nature website. Through the United Healthcare website, you can either enroll a MedSup, an MA, or a PDP plan. With that enrollment, then the consumer would receive a DocuSign link. DocuSign's super simple to get through. However, sometimes they struggle because they need to check a box stating that you're agreeing to DocuSign's terms and conditions, and then you need to actually begin the signature process. You can also enroll a consumer through Connecture through the DRX platform as well. I prefer the Lean app. I generally don't use the Connecture DRX app because it's basically the same thing, and I like the DocuSign on how it's set up through the Jarvis platform. So either way, you do have options in regards to that. Certainly, the applications are a pain in the hiney through United Health. I'd strongly suggest you print off PDFs so that way you're not trying to tear them out of the United Health books. Oftentimes they rip, etc. Once you have a PDF, or if you need one, just request one from SES. We'll send that over to you. You can store it and then print it off on your own as opposed to wasting your time trying to rip out pages out of an application book. Carrier requirements for WellCare. So WellCare offers an online application you can complete right through your WellCare portal. You can also complete through the Connecture DRX app, or my favorite is the consumer link. You can simply send your consumer a link. It's the wellcarerep.com / your agent writing number. If you haven't used this or tried it, certainly do so. I simply send the consumer a link in their email or text it to them. Super easy to do on a smartphone. The consumer just completes the application entirely on their own. And at that point in time, you're the agent of record, you have credit for it, and no storage, right? This 10 years of storing applications, 10 years of storing scope of appointments, all goes away when you're able to write this compliantly online. And obviously, I do save the applications. I go into the carrier portal and save them compliantly, in our storage through our server. However, as an agent standpoint goes, saving this in paper form for a decade gets ridiculous. This is not a time to stop writing business. If you have any questions, contact Agent Services 24/7 via text, You can always email us at agentservices@seniorenrollmentsolutions.com. You can phone us anytime, or you can Skype us at SES Agent Services. This is a very crucial time. Consumers are still needing your help. What needs to occur is you need to market, or we can help you market appropriately to get your phone to ring or to have enough compliant consumers to reach out to, get a script together. If you need help with the script, go back to our June or July workshops as we went through creating a script. Obviously, we have outlines for you as well in creating scripts, but that script has to be very fluid as you're doing the same thing over and over and over again as you're writing that business throughout the day. But with a good script and great follow through, there is no reason why you can't hit your goals or be hitting your goals, or more importantly, exceeding your goals for 2020. Once again, I'm John Fallett with Senior Enrollment Solutions. Thank you for attending. If you have any questions, concerns, let us know. I will be sending over links to what we've gone through, as well as this presentation here shortly. And then we'll also be posting it on our YouTube channel, the SES Agents YouTube channel. So be safe, be healthy, continue to write business, continue to service your community.